screen. Yeah. Yeah. I'm Dr. Hanju Ambaran Sharma, sports and exercise medicine, as well as clinical and medical physiologist, and the president of Indian Society of Sports and Exercise Medicine. Thank you for giving me this opportunity. So let's begin the talk with a definition of the clinical intervention. Physiology is nothing but the CIP is the physiological, nothing but the physiological intervention. Like, for example, use of the exercise, nutrition, physical activity, limitation of the sedentary behavior, or say stress coping, or sleep, or say mental health intervention, which is important for health and fitness promotion, maintenance, as well as for injury and illness prevention, treatment, rehabilitation, etc. And CIP, they form the foundation of the treatment pyramid upon which the pharmacological as well as surgical intervention do play. And sports and exercise medicine is one of the subspecialty of the CIP, as well as other specialties, like, for example, lifestyle medicine or functional medicine. Talking about sports and exercise medicine, you have to understand that the ultimate aim is stretching the physiological limit, that is the CITS, LTS, 40s, where the sports medicine, the foundation is formed by performance related sports and exercise medicine, with the ultimate aim of enhancing top-free human as well as the sports performance with minimization of the injury and the illness. And there is a exercise medicine. The foundation is formed by clinical exercise physiology. The ultimate purpose, the purpose is a use of the therapeutic use of the exercise and physical activity for health and fitness promotion, as well as for other say different type of the illness and injury management and treatment, like non-communicable disease, diabetes and all that stuff. And the applied clinical, application of the sports and exercise physiology is the sports and exercise medicine, where the sick patient as well as the elite player we deal with. And as I've already focused, the ultimate purpose is the top-free optimization of the human performance with the minimization of the injury and illness, and therapeutic use of physical activity in sports for health and fitness promotion, as well as for injury and illness treatment. So, why this is important? Because the relationship between the external and internal load with the injury, whether it goes into the injury or pathological side or into the positive physiological adaptation, depends upon your resilience, your fitness level, the moderator. So understanding this moderator is very important, and the moderator can be divided into health related or skill related. For health related, maybe cardiorespiratory endurance, body composition, where we focus on increasing lean body mass and decreasing percentage body fat. And the muscular fitness, like, for example, strength, endurance, flexibility, as well as the different type of the skill related, like agility, coordination, balance, power, reaction time, and speed. These are the different the component of physical fitness, and each component can be targeted by using a specific exercise intervention. And therefore, the physiological intervention in the form of sports and exercise training, as well as exercise prescription, is very important in this talk. In this talk session, we will be focusing more on sports and exercise training, because exercise prescription we may not be able to deal with because of the lack of time. So sports and exercise training can be done based upon the principle of what is known as SPORT, sporty. That is, it has to be specific. That is, specific adaptation happens to the specific demand. Everything has to be specific. It has to be progressively overall accompanied with adequate recovery so that positive physiological adaptation happens. And if you remove the physiological stimulus, then what will happen? Whatever you gain, you may lose. This is the principle of the reversibility. And everything, like, it may be volume of the training, intensity of the training, technique has to be varied depending upon the requirement, as well as depending upon the phases of the training. This is the principle of the variation or periodization, and each principle has to be individualized because each individual is different. And law of diminishing return is there. That is, if you give the same training to an elite player or a novice or a amateur player, the amateur player, newcomer, then what will happen? Adaptation will be more in case of the newly uh, recruited player as compared to the elite player. And similarly, the exercise prescription principle has to one has to follow the fit BP. There is frequency of the exercise. You have to prescribe the frequency, intensity of the exercise, time of the exercise, type of the exercise, volume, as well as progression and the pattern of the exercise. The exercise can be anything, like for example aerobic, resistance training, flexibility, or balance. And upon this fit BP, you have to add the chrono exercise also. That is time of the day where exercise has to be prescribed, depending upon your circadian rhythm. And everything has to be planned out depending upon a smart, in order to achieve the smart goal. Setting the smart goal, there is specific, measurable, attainable, realistic, and time bound. And based upon this principle, we can achieve the appropriate exercise intervention. Because if you give under training, then performance will not be occur. There is suboptimal performance will be there. But if you give overtraining, then overtraining, injury and illness, and overtraining syndrome and physiological maladaptation may occur. Therefore, you have to target the overreaching. That is the optimum physiological adaptation, where what is known as physiological supercompensation happens, and performance enhancement can happen. Otherwise, what will happen? Relative energy deficiency in sports, that is REDS, the can occur, because high intensity of the training accompanied with a lower say energy availability, or overtraining syndrome can occur. And monitoring is very important. Monitoring can be by use of different biochemical as well as physiological parameter, like for example HRB, or say the testosterone by cortisol ratio, and different type of the biochemical as well as the physiological and clinical parameter are there in order to monitoring the adaptation. Going ahead with the exercise training intensity, what you have to understand is the exercise can be the physiological stress can be divided into different intensity: very light, moderate, vigorous, and near maximum, depending upon say percentage of the VO2 max, or by using what is known as metabolic threshold 1 or 2. Metabolic threshold 1 is basically the anaerobic threshold, and 2 is the respiratory compensation point. And depending on that, different zone can be prescribed. Like for example, this is a zone 2, this is a beyond zone 2, where the intensity is a vigorous, or it may be below zone 2, that is intensity may be light and very light. Or the intensity can be divided based upon the subjective scoring. Like for example, Borg scale, there is rating of perceived exertion from 6 to 20, or modified Borg scale from 0 to 10. So all this thing, the intensity can be used. Like for example, HIIT, high intensity interval training, is focusing on vigorous and a near maximum exercise. Or sprint interval training, SIT, it is focusing more on supra maximal zone. So we understand that this what you call the exercise intensity, based upon different type of the parameters we can use. Like for example, percentage of the heart rate maximum, we can use. Heart rate maximum can be calculated simply by 220 minus s, or more reliably by 208 minus 0.7 into s in year. And percentage HR max can be divided into very light, moderate, vigorous, near maximum, like 57, 64, 77, 96, 91. Or it can be divided into this like for example, this is the anaerobic threshold, or corresponding to the lactate threshold, and this is the RC is nothing but the respiratory compensation point. And what is the difference between them? It is the isocoupling buffering zone, and beyond the RC is the HSB. There is hypocoupling hyperventilation phase, and these are the different phase. By using gas analyzer, you can easily find out. And also we can target different energy system, like for example phosphation system, or anaerobic glycolytic, or aerobic system. Like for example, if you want to target aerobic system, most of the time we target the aerobic system by monitoring the heart rate, keeping the heart rate around say 55 or 60 to 90% of the heart rate max, or say 40 or 50% to 85% of the VO2 max. In this way, you can target a particular the particular energy system. This cardiorespiratory fitness is very important. Why? Because the cardiorespiratory fitness, the more cardiorespiratory fitness means, the less will be a relative risk of injury. That is, in all, it not only protect against injury, but also for different say non-communicable diseases, like for example diabetes. Based upon this, we have published different paper on player as well as diabetic patient. And here you can see that this is the graph. You can see this is the x-axis, the percentage body fat, and you can see that they are all negatively related. Like for example, red line is the VO2 max, negatively related, associated with the percentage body fat. Green line is the RC, there is respiratory compensation point, and blue line is the AT, there is anaerobic threshold. All are negatively related. Similarly, here in this graph, you can see that x-axis is the exercise duration, and everything is positively related. Like blue line is nothing but IV, there is isocapnic buffering, and this red line is the VO2 max, VO2 max, and a black line, this black line is ISSB, there is hypocapnic hyperventilation, and green line is the RC, respiratory compensation point. Similarly, HRV parameter are also related with the aerobic fitness. Like here, you can say that RM, SSD, and SD1, they are positively related with the VO2 max. Similarly, for type 2 diabetics, you can see that this blue line is the control, and a red line is a type 2 diabetic male. You can see that type 2 diabetic male has a lower VO2 max, as well as heart rate recovery. They recover, their heart rate, they are very slow heart rate, after the exercise recovery is slow. And it is significant difference in VO2 max is still there when you control for the difference in body composition. That means in spite of the controlling the body composition, the diabetic patient has lower cardiorespiratory fitness. This is important. And again, and again, you can study the relationship between, say, cardiorespiratory fitness with the glycemic control. X-axis is the HbA1c, and you can see that everything is negatively correlated. This is the what is called red line. Red line is a VO2 max, and the blue line is the 6-minute walk distance. And these are important because the cardiorespiratory fitness, functional exercise in the form 6-minute walk test, they are inversely, their performance is inversely related with the, worsening of the, say, glycemic control in the form of the HbA1c. So cardiorespiratory fitness maintenance is important. And cardiorespiratory fitness testing is also important. You can diagnose loss of the disease depending upon which part of the system is get involved, according to the fixed principle or the fixed equation of the VO2 max. Like for example, by using this equation, you can see that if a particular person is having low peak VO2, that is less than 85%, and if anaerobic threshold is lower, and you see the breathing reserve, and again, if the breathing reserve is normal, then it may be because of the circulatory impairment. If it is less, then it may be mixed lesion, that is respiratory as well as cardiac. So in this way, you can easily diagnose whether a particular reason for the exercise limitation is cardiac or respiratory or mixed, or it may be, say, obesity or anxiety. Everything you can easily diagnose by using the cardiorespiratory exercise testing. Similarly, different other algorithms are also present, which I will not go into the detail. And a most common form the exercise prescription which is given for the cardiorespiratory fitness improvement is running. But running can be prescribed depending upon the different type of the foot strike pattern. Like for example, rear foot strike, and when you see, this is the mid foot strike, this is the mid foot strike, or non rear foot strike, and you can see that there is a difference in the what a vertical ground reaction force. This peak impact is present, and the loading rate is high in case of the rear foot strike, and therefore the injury pattern may also different. Like for example, suppose a knee injury, the rear foot strike is more associated with the knee injury as compared to the non-rear foot strike, whereas the Achilles tendinopathy or Achilles problem is associated more with the what you call the forefoot strike. So based upon this strike pattern, different injury profile may be there, because vertical ground reaction depends. Like for example, it depends not only on the pattern of the strike, but also on the speed. Like for example, if you are running, say, then the vertical ground reaction can reach up to 2.2 times of your body weight. This thing one has to understand. But however, metabolic rate of the running is similar, whether you run by, say, 4 foot or non 4 foot. And these are the different the muscles which you have to focus. If you want to prevent particular overuse injury, or if you want to improve the running, because the running economy, efficiency of the running improvement is one of the most important thing which we have to focus in case of the elite runner in the physiology lab. And most of the time, people again come to you for fat burning. Like for example, they want to target what is known as the maximum fat oxidation rate, which is near about say 55 to 72 percentage of the VO2 max. And because see, you by this traditional diagram, you can see that this crossover point happens around this much, because beyond this say 80% of the intensity of the exercise intensity, then the energy contribution by the carbohydrate increases, whereas the energy contribution by the fat decreases. So if you want to burn fat, then your intensity has to be a little bit lower. But again, this depends, this crossover point depends upon the study subject. Like for example, if the study subject is a fat adapted person, then this crossover point moves to the right side. That's why a higher, even at a higher intensity, the contribution of the fat will be higher in those case. And the point which you have to understand is based upon this, this principle of the fat oxidation, methadone and slow running technique has been developed, where they target the running heart rate. This is the heart rate, spelling mistake is there, where 180 minus s in year is being targeted for particular slow running. And the purpose of this is the oxidation of the fat. Again, you have to understand that running is also form of the exercise which is mostly prescribed for diabetic patients, because up to 2 gram or 120 gram per hour of glucose oxidation can occur during the exercise. But the liver, but if you do high intensity exercise, then hyperglycemia can also occur, because the liver can produce glucose up to 10 times during the intense exercise, because normally we have only 4 gram or 1 teaspoon of sugar in our blood. This one has to understand. So depending upon the exercise, which type of exercise you have to prescribe for diabetic. Like for example, if you give an aerobic exercise, then reduction in blood sugar can occur. If you give a very high intensity exercise, then hyperglycemia can occur. So depending upon type of exercise, you have to adjust. This is this principle is important. And EMG based training is also one of the most important concept which is going on. Like for example, soleus push-up, by using the EMG based method you can use. And this is very simplistic method as well as very highly effective, because see, by just sitting the sedentary time, you can do soleus push-up, and soleus push-up has been shown to improve the oxygen consumption very, very much as compared to the inactive sitting. And soleus consists only 1% of the your body weight, and you will be able to do this exercise for a very long time, because they are a fatigue resistant. And you can see that the reduction in glucose as well as insulin is very, very high, whether you follow different type of the protocol, the reduction is very high. So therefore, the soleus push-up is a very simple and effective method for especially for diabetic person, for reduction of the glucose as well as the insulin spike. This one has to understand. EMG based method you can also use in order to quantify the muscle activation force and fatigue. Like for example, say if you see fatigue is there, then you can easily identify by say median power frequency, or mean power frequency will be higher in case of the fatigue is there. Whereas the RMS, that is root mean square, is directly proportional to the force. So force as well as the fatigue study can be done by using different EMG based study. Like for example, here in this prototype which we have developed. And the training can again be used by using the Hensman size principle, where recruitment of the higher motor unit happens at the higher requirement for the higher force. Like for example, this is the type 2 fiber is activated at a higher force and as compared to the type 1 fiber. And again, when the producing the same tension, the recruitment will be more if you do a more angular velocity. That is more, the more with the recruitment is directly proportional to the angular velocity. Faster the angular velocity, more recruitment will be happen at the same tension. So this 2 point is important, because if you want to recruit a higher recruitment, then you have to use a higher load, that is 1 to 5 rm as compared to 12 to 20 rm, or you have to perform a particular task at a very high angular velocity. Why this is important? Because if you want to target full activation of the muscle for muscle hypertrophy, say muscle build up, then you have to base your exercise on muscle recruitment pattern based on EMG. Like for example, if you want to have a hypertrophy, then you have to target a type 2 muscle fiber, which are larger and which are capable of producing more force. Like for example, here in this case, you can study that this is the when the weight is coming down, then eccentric contraction of the quadricep happen, and during the eccentric, the surface EMG interference pattern relatively decrease. Now, decrease because if you use the same load, But you don't want this decrease to happen, because decrease means activation of the muscle fiber is decreases, which you don't want, because if you want to achieve the full muscle hypertrophy, there is muscle activation. So in order to reduce this decrease in interference pattern, you can increase the load during the eccentric phase by say 1.5 times of the load which you use during the concentric phase. Then only 30% higher drive in EMG can happen, and this is based upon the force velocity relationship which we particular study. And this eccentric the part of the training can be achieved with a higher recruitment of the muscle fiber. So this is important. These are the variable resistance machine, where the resistance of the machine can be increased or decreased depending upon a phase of the different type of phase of the movement, like for example eccentric or concentric movement. Similarly, biomechanical based training is also important, where you focus on different abnormality of different biomechanical. Like for example, if you don't have ankle, your restricted ankle mobility, or say tight hamstring, then butt wing will happen. And similarly, lots of other biomechanical consideration you have to understand. Like for example, if your knee is going too much away from the toe, then more stress will be there in the knee. And similarly, if you have a knee problem, then you can modify the exercise in such a way that by inserting a stool or so. But again, in this position, more stress will be there for spine and hip. So depending upon the more stress you want to load on the knee or the hip, then you have to change the exercise intervention. Similarly, in this squat pattern, you can see that this is the momentum that is perpendicular distance from the axis of rotation to the line of the force. The more with the momentum, then the more will be the torque. And here you can see that if you do more on this, then uh, the more will be here in this exercise, more stress will be there on the knee as compared to this exercise. But at this exercise, because of this larger momentum, more stress will be there at the hip joint. So depending upon different type of the injury pattern, you can modify your exercise intervention. Similarly, here it is the back squat, which is more challenging for the hip as compared to the split squat, which is less challenging. Similarly, different type of the different type of the sumo lift modification you can do by using different pattern. Whether you want to challenge the hip or you want to have less challenging, like for example, if you're using a trap bar deadlift, then it will be less challenging for the hip. Like for example, here you are using a what you call a trap bar deadlift, where this momentum is relatively small, so there will be less challenging to your back and hip. This is important. Again, depending upon a foot position also, you can target a particular muscle hypertrophy. Like for example, if your foot is pointing outward in when you do exercise for the calf muscle, then you will be targeting more on this particular point, that is the medial gastrocnemius. Whereas if you want to target the lateral gastrocnemius, if you point in, your toe is pointing in, then it will be targeted. So depending upon this, different exercise training can be prescribed. Like for example, here is the incline flat or decline bench press. So which particular muscle you want to target? Like for example, if you want to target the anterior deltoid muscle, then incline bench press you can target for the anterior. This is the anterior deltoid muscle, but which is not there in case of a decline, bench press. So depending upon this, you can do again. For the momentum also, depending upon for external momentum, you can design a particular exercise. Like for example, bicep curl, this is the longest momentum is happening at the 90 degrees, so the more challenging will be there in case of the 90-degree. But if you do a what you call the pisser curl, then at the stretching point of the bicep, where the bicep is as long as the momentum will again will elongate, the hardest will be there at this point. So depending upon the range of motion and the depending upon the different type of the pattern, you can basically modify the exercise pattern. Similarly, for strength curve based training can be done based upon what you known as the optimum angle, where the torque production will be maximum. This is known as the optimum angle. Like for example, for say elbow flexion, it may be 72 to 120, or elbow extension 90 to 120 degree. And similarly for other muscle groups also there. And and this we can this strength curve, this is a strength curve. It can be measured by using a simple protocol which we patented, and it was introduced as a practical for MD physiology as well as for MBBS student. You can measure the strength curve for the elbow. It can also, this machine can also be used for the leg, quadricep and hamstring. And the strength curve based training is very important. Like for example, this is a typical strength curve where at the starting of the exercise your strength is very very high, but when you when you reach near the stop of the exercise your strength is less. Like for example, this is a chin up, or the or the let's pull down, this type of exercise. The initially your force ability to force pressure is very very high as compared to the stoppage of exercise. Similarly, here, the another point is the starting of the exercise, your force production will be less as compared to the at the end rest, like for example, bench press. So if you hang a particular chain, then initially when you are not able to produce the force, the weight of the chain is hanged by the this floor. But when you lift it, then the gravity will act on, and at this point, more weight will be added to the bar, and at this point, since you are able to lift the weight, then more appropriate loading of the muscle can happen. And this is the concept of the use of the chain, or say different type of the what you call resistance band and all this thing. Similarly, at this point, see, rupture of the pectoralis muscle can happen at this point where your ability to produce force is minimum and eccentric contraction is very very high. So at this particular point the rupture happens. This is known as sticking region. So in this way, exercise, can be divided or can be modified based upon this principle. Again, you have to understand the principle of the muscle, centric medicine, where we focus on the muscle, there is skeletal muscle, because after 40 years, sarcopenia and dyspnea happens. It is detectable at 50. The muscle mass loss can be say up to say 0.8 to 1% per year, or say 0.5 to 1.2% of muscle mass per year can happen. And sarcopenia is very important because most of the disability, most of the non-communicabilities are because of the sarcopenia, and therefore you have to target by using adequate nutrition as well as the adequate exercise for countering the sarcopenia and for improvement of the muscle, because muscle is the organ for longevity, whereas fat is the organ for inflammation. One has to understand. And like for example, hand grip, simple hand grip is a very powerful tool for predictor of the cardiovascular mortality, even more important than blood pressure. And again, for diabetes also it is very important, because here you can see that if you are an athlete, irrespective of whether you are young or old, your ability for insulin mediated glucose uptake is very very high, even if you are old age. But if you do exercise, then your insulin sensitivity will maintain, because your muscle mass will be preserved. Because if you don't do any kind of the exercise, then your muscle mass loss will be there, sarcopenia will be there. This is very important in the case of the India, where toffee is there. There is thin outside, fat inside, where visceral adiposity, central obesity very high with thin muscle, there is known as toffee. And because of this phenotype, Asian Indian phenotype, the diabetic as well as a pre-diabetic as well as diabetic is very very high in India, especially in country like in a state like for example Madhya Pradesh, Rajasthan, where the prevalence is very high. It is equal to more than 15%. Whereas in case of the diabetes, here you can again Maharashtra, Karnataka, and all this thing, the diabetic prevalence is high. So this muscle centric medicine is very important. And it's also important for the injury prevention or injury management. Like for example, if you have a more body strength, then what will happen? Your risk of injury, relative risk of injury will be less. And again, for strength training has been found to be very important for injury reduction of the injury risks as compared to the other type of exercise, like for example stretching. So strength training is very important, and depending on upon that, we have published different papers. And similarly, anaerobic and muscular fitness, like wind gap test, anaerobic, RAST test, plyometric test. We have used, published different paper, and also we have published one booklet on stretching. And based upon the principle of the muscle imbalance also, which we can measure by using the dynamometer or isokinetic machine. different exercise program can be designed. Like for example, say depending upon a quadricep or hamstring ratio, like what is known as the ISQ ratio, there is hamstring to quadricep ratio. Depending upon a different percentage of the ratio, we can design different exercise protocols, because this hamstring is very important, especially for the protection of the ACL rupture and stability of the joint. So if this ratio we should be around 50 to 80% or approaching to 100, if it is very low, then that means your risk of the ACL injury is very high. So this one has to understand, and depending upon that, a different type of exercise intervention can be done. Like for example, similarly, if you have a gluteus weakness, weak gluteus is there, then opposite side quadriceps lumborum tightness can happen. Like for example, here is a Trettenbach get is there, and this may be associated with a low back pain, and therefore appropriate exercise intervention you have to give. Like for example, say valgus, the inward of the knee can happen, like internal rotation, hip abduction, valgus on the valgus force on the knee, internal rotation, or foot pronation can happen. In fact, foot, tibia external rotation can also happen. This can all result as a result of the gluteus medius weakness. So depending upon all these things, you can give exercise prescription, because once this position is known as position of the no return, and it is associated with a rupture of the ACL. So ACL for ACL prevention, exercise you have to target. The different type of the jumping and different type of the landing technique you have to focus, depending upon say exercise targeting the gluteus medius and all that stuff, hip external rotator, hip abductor, hamstring. So all these things you have to target. So depending upon a requirement, exercise training can be given. And similarly, based upon say Zanda's muscle imbalance, which may be associated with say neck pain or lower back pain, different exercise tightness, or say what you call weak muscle may be there, and depending upon the requirement, you can do different type of the manual muscle therapy or manual therapy or trigger point therapy. You can do, like for example, by using the principle of the autogenic inhibition and a reciprocal inhibition, which is autogenic inhibition is the inhibition based upon the Golgi tendon organ activation, or reciprocal is if you activate the antagonist muscle, then the agonist muscle would relax. This simple principle of the physiology you can use to target, to particular relax and more stretching of the muscle. Like for example, hamstring stretching can be done if you do isometric, post isometric, relaxation of the hamstring. This is the whole relaxed PNF stretching, proprioceptive neuromuscular facilitator. Similarly, you can do the isometric contraction of the hamstring or contraction of the quadricep with the accompanied with the isometric contraction of the hamstring. All these things can be used for more stretching and more relaxation of the hamstring. These are the principle of the autogenic and reciprocal inhibition we use for improvement of the stretching. And similarly, the muscle energy technique is again based upon same principle of the autogenic and the muscle reciprocal inhibition. Like for example, autogenic inhibition post isometric relaxation or post facilitated stretching you can use, or reciprocal inhibition. Like for example, here it is the stretching of basically relaxation of the hip external rotator or hip this is the psoas muscle, iliopsoas muscle or quadricep muscle. This may be associated with back pain. So different therapy we can target. And similarly for say spasm of the quadricep spasm or calf spasm can be happen because of the fatigue. Fatigue may causes exaggeration of the muscle spindle and the lower activation of the Golgi tendon organ. This can be reversed by using a simple stretching exercise, and therefore exercise associated muscle cramp you can treat by using this simple what you call the physiological the principle. Similarly, exercise prescription one can use the eccentric exercise prescription because of the phenomenon of what is known as mechanotransduction, where because of the stretching between the collagen fiber, protein synthesis can happen, and this protein synthesis is important for a degenerative, condition like, for example, tendinopathy. Like here, you can use the eccentric the exercise, like these are important component for plyometric exercise, and this eccentric exercise basically shifted this what you call the length tension relationship, to the right side, so that the particular muscle is able to withstand more force, and therefore it may protect against against the external force. And therefore, the eccentric exercise training is important for prevention as well as for therapy purpose also. Like for if you are having a adductor tendinopathy, then Copenhagen adductor exercise is important. Or you can use a Nordic hamstring curl for the hamstring exercise for prevention as well as the treatment, or say decline, squatting 25 degree decline squatting for patellar tendinopathy, or L-Fretchen hill drop protocol for mid insertion Achilles tendinopathy. So these are the different exercise therapy. Similarly, for nerve also you can use, like for example, nerve flossing slider, tensioner for median nerve, ulnar nerve, or for lower limb, you can use based upon a principle of the exercise physiology. Again, understanding the exercise physiology help you to manipulate the exercise, physiology, and by manipulating exercise physiology, you can achieve your target. Like for example, for muscle hypertrophy, three things are required: metabolic stress, mechanical tension, or microscopic muscle damage. Suppose if you want to achieve the metabolic stress without achieving the mechanical tension, like if injury happens, then you may not be able to lift a heavy load in there. But if you want to achieve the muscle hypertrophy, then instead of the lifting heavy load, you focus more on metabolic stress. And you can induce the metabolic state by using what is known as blood flow restriction training, by using just a cuff where you restrict the venous outflow. Then you can basically increase the metabolic stress. And here in this paper you can see that the decrease in the cross-sectional surface area in case of the muscle, quadriceps muscle, in case of the knee immobilization, is very, very less if you do blood flow restriction training as compared to the control. So post ACL reconstruction surgery. So this blood flow restriction training is highly useful. It can be applied for different aerobic exercise, resting exercise, isometric hold, and various type of exercise. And we have done a particular workshop on this technique during the ISSEM Con 2022 March at Chennai. And similar manipulation you can use by using the targeting the pathway, the motor pathway to that particular muscle. It can be targeted by using what you call the mental imagery or mental technique training method. Or you can use what is known as PAP, that is post activation potentiation, or say post activation performance enhancement, or where this is the concept of the post activation performance enhancement. That is, after doing maximum voluntary contraction, your peak force will be improved, just because of the priming of that particular channel, when fatigue is not there. So this technique is the post activation potentiation. If it is less than 1 minute, if it is more than 1 minute, then we call it basically what is known as post activation performance enhancement. Similar technique you can use by the activation, by using TDCS, that is transcranial direct current stimulation of this pathway. There is, you may do anodal or cathodal stimulation, and then after stimulation, then performance enhancement may be there. And this is basically the technique which we use for extension of the technique which we use for intraoperative neurophysiology, where we stimulate the the motor mapping. We stimulate the motor area and record from the muscle. So this technique is basically, the application of this technique is there in case of the sports science. Similarly, exercise as medicine is very important, because exercise is a form of medicine. As a medicine, it has been used in different type of the medical problem, because it is associated with lots of the health benefit. Like for example, you can see that in case of the cardiac disease, the 40% reduction is there in case of the exercise, whereas drug or surgery benefit is only say 24% with statin. Similarly, for type 2 diabetic, 58% incidence reduction is there in case of the exercise, whereas for metformin, only 31% reduction is there. So exercise is a very important part of the medicine. And exercise is medicine is a national, a national center which we are, our society is about to launch under exercise medicine of American College of the Sports Medicine, where we will be training. We will launch different training for healthcare professionals on different aspects of use of the exercise and physical activity as a medicine. And lastly, we want to focus on exercise in the COVID. There is, and as well as the vaccine. We have to be very, very careful for myocarditis and pericarditis, because 25 to 25% of the sudden cardiac death in athlete can be associated with the myocarditis and pericarditis. And another point which you have to understand is these symptoms are highly confused with the overtraining syndrome, which may be present in case of the training, in case of the elite player. So one has to understand. But irrespective of whatever be the reason, if myocarditis is present, then at least 6 months of no sports activity is there. For pericarditis, at least 3 months is there, and our society has published a detailed guideline on return to play on sports and exercise, sports and exercise after uh, uh, the COVID, which can be easily available online. So thank you very much. The point which I want to make is exercise and sports physiology form the basis of everything. From sports and exercise medicine to functional medicine to lifestyle medicine to performance medicine. To sports and exercise medicine is the evolved version, is the application of a clinical physiology, and the purpose is we want to have a positive physiological adaptation by having positive lifestyle, physical activity, and exercise, so that we achieve what is known as the performance, fitness, and health, not only human performance, but also for top-free sports and exercise performance with minimization injury and illness. Thank you very much.